to check the underlying condition. Is it as a result of a condition that is life-threatening, or a degenerative condition, for example, the osteoarthritis that a lot of you have come across in the clinic? So you see, these are the things to look out for, and the prognosis is usually very poor for chronic pain. Very poor. Most times you talk about conservative management, for example, the osteoarthritis we just mentioned. People just learn to manage, just manage the pain, because if it's as a result of cancer, for example, so if the cancer is there, of course the pain will remain there. And most of these degenerative conditions like osteoarthritis, other degenerative conditions, I would like you to go check up. But the typical and the most common ones we are aware of is osteoarthritis. We have other syndromes like the Dick syndrome, spondylosis, spondylolisthesis, etc., etc. Most of these conditions are actually incurable. People just learn to manage it, except by a miracle. Of course, miracles happen every day. All right. So, when we talk about the next one, I want to talk about is the neuropathic kind of pain. Neuropathic pain is often very difficult to diagnose because its origin is usually psychological. I mentioned that in class, I remember. I said when you have assessed the patient, you've done every other thing you should do, you've ruled out every other condition, and the patient still insists. The patient, because pain is what the patient says it is, you are not the one to, classify the pain for your patient. Then you should start looking into other issues, psychological issues, because it could all be in the head. Now, this is where the neuropathic kind of pain falls into. It's deep, usually psychological, although sometimes it could be a combination of both damage. It could be as a result of nerve damage in addition to psychological issues. However, this type of pain usually can be worsened by a lot of issues. For example, stress. If the patient is the type that is highly, let's say, is always very anxious, worried, highly emotional, highly stressed out, is going to worsen this condition. And that is why I said pain is highly spiritual and psychological. By the time you double check all those things, try to befriend your patient, dig deep, and start your psychotherapy. In fact, for this type of pain, the neuropathic type of pain, if you don't address it psychologically, the patient will not benefit from whatever therapy you are carrying out. Okay, that's that. Now let us focus on childbirth pain. I think we discussed this in class. Of course, when a woman is in labor, I'm so happy that we have mothers in the class. When labor pains come up, for those that have passed through it, is a peculiar kind of pain that so many women can't really explain. Somebody said it's like all your whole bones breaking at the same time. So you can imagine how painful that kind of pain. You can imagine it. Because usually when a woman puts to bed, the joy of seeing her child makes her forget all those things. However, childbirth pain is very, very peculiar. And that is why a lot of researchers, have deemed it fit to go deeper and investigate this particular type of pain. Now, when labor occurs, of course, you have contraction of muscles, a lot of muscles, especially that of the uterus, contracts just to help push the baby out. Now, when this occurs, the pain usually get referred to other parts of the body. For example, during contraction, you have referred pain to the abdomen, you have referred pain to the back, to the pelvis, and expectedly should subside after childbirth. Now, a lot of studies have been conducted, like I mentioned in class to you. A lot of studies have been conducted regarding the childbirth experience and culture. It has been discovered that women who were active in their religious faith seem to accept pain as, an inevitable and important part of life. So please go and check up the work of Callista et al. 2022. Go in depth. If you Google it online, go to Google Scholar, you will see all the publications and related works. Why am I referring you? Because at this stage of your learning, you should be doing more of research. You don't just depend on what your lecturer gives you. Like, you keep asking for notes. Each time I see your message, I laugh. Because I like to refer you. Because it's when you write during exam, I will know those that really checked up. Whatever your lecturer gives you is more like a guide for you to go and search and gather knowledge. Is that okay? Now, bear in mind that childbirth pain is very unique and complex. It's different from the pain of, say, disease, trauma, medical or surgical, whatever. It's very, very unique and complex. And that is why a lot of studies, although of recent, let's say 2000, people started really giving it attention. But I believe that even up until today, people are really going in depth. If you go online, you will see a lot of ebooks on just childbirth pain. It's a different standalone topic all on its own. Is that okay? Now, the myofascial type of pain, have we talked about that one? I think, have you done myofascial massage? If you have done myofascial, you should know anything myofascial has to come from trigger points, okay? When we talk about trigger points, for example, the acupuncture points,